Interpersonal relationship in nursing. An interpersonal relationship is a social connection or affiliation between two or more people. Interpersonal relationship can include your partner, loved ones, close friends, co-workers, and many others who make up the social connections in your life. Can you define interpersonal relationship? Interpersonal relationship have been defined as it is any or all behavior which a person undertakes in the presence of others. These are social associations, connections, or affiliations between two or more people. Types of interpersonal relationship. 1. Friendship. Theories of friendship emphasize the concept of friendship as a freely chosen association. Second, family. Family communication patterns establish roles, identities, and enable the growth of individuals. Family dysfunction may also be exhibited by communication patterns. Three, romantic. Romantic relationships are defined in terms of the concepts of passion, intimacy, and commitment. 4. Professional relationships. Professional communication encompasses small group communication and interweaving. Purpose of interpersonal communication. One, to learn about self and society. Two, to establish, maintain relationship. Three, to elevate loneliness. Four, helps for diversion. Five, helps to meet the needs of others. 6. Gain confidence and satisfaction. Stages of interpersonal relationship. According to George Liebing, a psychologist, there are 5 stages. First stage, acquaintance. Second stage, the building up. Third stage, continuation stage. Fourth, deterioration. Fifth, termination stage. Detail going on. First, acquaintance. It depends on previous relationship, physical proximity, first impression, etc. Second, build up. People begin to trust and care for each other. 3. Continuation. It follows a mutual commitment for a long duration. 4. Deterioration. Not all relationship deteriorates. Some may deteriorate due to loss of trust or dissatisfaction. 5. Termination. This final stage leads to an end of relationship by separation. Principles of interpersonal relationship in nursing. First principle, mutual benefit. The strong interpersonal relationship are formed when people share some group of interests. It helps them to form a strong bond and meet up the social need of themselves. Second principle, credit. For making the relation with the people fruitful and pleasant, it is important to make up feel that you are useful for them. 3. Respect principle. Everyone has a right of freedom to speech. So everyone has right to share their thoughts. Only through respect one can maintain good interpersonal relationship. 4. Tolerance principle. Tolerance means that a person does not care about small minor issues, and by keeping aside the disturbing issues. 5. Moderation principle. To maintain a good social interpersonal relationship, one should keep a moderate way to deal and communicate with people. Interpersonal skills in nursing. Those who are skilled communicators help establish trust with patients and elicit cooperative responses to treatment plans. By demonstrating interpersonal skills in nursing, registered nurses can also establish positive relationship with their peers and colleagues. This ongoing positive relationship can have a far-reaching impact. The following interpersonal nursing skills and other traits help nurses promote relationship with both patients and co-workers. One, active listening. Two, concise verbal communication. Three, patience and awareness. Four, relationship building. Five, conflict resolution. Six, critical thinking. Seven, fostering positivity. Detail going on. One, active listening. Perhaps the most important skill a nurse can possess is the ability to listen actively. This is particularly critical because most patients do not have training in medical terminology and symptom diagnosis, etc. As a result, nurses must listen carefully to decode the symptomatic clues that patients communicate and verbally rewarding those responses to ensure accuracy. Second, concise verbal communication. Nurses assume the responsibility of relaying accurate information between physicians, patients, and the families of the patients to ensure effective treatment decisions. Clear interpersonal communication in nursing is important in both verbal and written contexts. During emergencies, accurate information can make the difference between life and death. Concise verbal communication is also essential between co-workers. If nurses convey inaccurate information to one another, the patient can suffer. Three, patience and awareness. Patience plays an important role in many aspects of nursing. Effective caregivers provide information in a manner that calms family members without internalizing anxious or agitated reactions. With a calm and professional manner, nurses can reassure upset, impatient, or demanding stockholders that they will receive information as soon as it develops. This is especially applicable when patient cases result in an undesired outcome. 4. Relationship building. A team-oriented mentality usually correlates with effective interpersonal communication in nursing, with improves organizational performance and job satisfaction. Many factors converge to shape a nurse's frame of mind when working and communicating together with colleagues. These include each person's emotions, perceptions, experiences. While nurses cannot control most of these factors, they can work to build a team environment that provides support in coping with life and professional circumstances. They can also strive to make interpersonal communication an effective, natural part of the nursing processes. Five, conflict resolution. Conflict need not take a disruptive undertone. In fact, nursing professionals can use conflict as a positive learning opportunity. Conflicts arise due to variables such as opposing opinions, beliefs, emotional states, and outlooks. Interpersonal conflict can take place when two or more nurses disagree, or when a patient disagrees with a nurse. Competitive conflict can occur when nurses against each other to accomplish the same or a different objective. Six, critical thinking. It is important that nurses evaluate information with a critical mindset, especially if they sense something is wrong or inaccurate. In these instances, it is better to put personal feelings aside and blunder on the side of caution. As professionals, nurses are entitled to full explanations about activities that affect work matters. By ensuring that information is accurate, nurses can maintain positive relationship with their patients and peers, as well as reduce miscommunications and help rectify problematic issues. Seven, fostering positivity. In the caregiving setting, effective nurses support intelligent questioning to promote an environment that values teamwork, relationship, and trust. Fostering positivity in a healthcare environment benefits everyone. Patients can feel more comfortable as they adjust to their medical situations. And nurses can feel confident as they work in a productive and uplifting environment. Open and effective interpersonal communication will remain crucial to the successes and effectiveness of healthcare providers. Barriers to interpersonal relationship in nursing. First, physical barriers. Second, perception. 3, emotional barriers. 4, cultural barriers. 5, language. 6, gender. 7, defensive. Strategies to overcome barriers of interpersonal relationship in nursing. 1. Be open to others' opinion. 2. Choose your words carefully. 3. Look for similarities. 4. Work with the facts. 5. Admit when you are wrong. 6. Smile. 7. Pay attention to verbal cues. Thank you. Have a wonderful day.